The year 2020 will be remembered forever for the COVID-19 pandemic. It shattered the normal life and destroyed the economy of the world. The pandemic disease spread across the world to every nook and corner. While top scientists are working tirelessly to find the vaccination, how do we handle such extreme situations until then? What does the ancient Indian practice teach us? Presenting Professor Dr. H.T. Sreenivas.
Hello ladies and gentlemen, welcome to Physeek Cafe. Physeek is your online health and fitness platform. We bring you the best advice from highly qualified doctors and fitness professionals. Today in our show, we have a highly esteemed guest, Professor Dr. H.T. Sreenivas. Join me in welcoming Dr. Sreenivas to the show. Hello sir.
Thank you, Mr. Vijay. I am Dr. Sreenivas. I started practicing Ayurveda right from 1976, and also I was into collegiate education. I started my career as a lecturer in Ayurveda in Bellary Taranath Ayurvedic Medical College. Later I was transferred and I have served in Government Ayurvedic Medical College, Bangalore, where I also got educated for basic degree and also postgraduate degree. I have put in almost 40 years of service in practice. I have treated many cases. I was into government. In 1979, when there was an outbreak of Japanese bee encephalitis in Tumkur, I was posted as a camp doctor. I have treated many patients. And in 86, I was posted again to Kolar along with Dr. Sanappa. He was my team leader. And there also we treated for the epidemic of Japanese bee encephalitis, that is brain fever. And later I got promoted as assistant professor and then professor. And I was principal for the same college in which I studied for about 3.5 years. For 1 year, I was joint director for medical education Ayush for Karnataka. And now I got retired in 2012. I am now practicing, having my own private practice in Ayurveda. I am also a visiting doctor in Ayurism near Marathali Bridge. I visit there thrice a week.
Thank you so much, sir. Thanks so much for the introduction. And we understand you have put in pretty much all your life into Ayurveda and come a very far way into the service. In the current generation, where English medicine has been dominating the current world, Ayurveda, I feel, is an underrated practice. Not many of us, including myself, have the full knowledge. Can you please talk to us about Ayurveda and its origin?
Yes, definitely. It is a good question. So first you told about the performance of Ayurveda, what the society knows about it. Firstly, we should think that Ayurveda was true fact in the past, in the present, and in the future also. The medicines which were there active 2500 to 3000 years back are also of the same grade, same active today also, and will be the same tomorrow also. Not like modern medicine. Maybe in this century you must have observed that the medicines which were produced in the 21st century, beginning of 21st century, like sulfur drugs, and then they were there for 10 years or 20 years or 30 years. They were withdrawn from the population because they are of less effective and may be having adverse drug reaction. Later came the penicillin, tetracycline, chloramphenicol, many to number, many numbers. All of them were introduced into the population after a scientific laboratories research. They are the outcome of scientific laboratory research as the best drug, best effective drug, and over a period of decade or two, and they actually lost their criteria of being effective. So this is the most important thing that one should note. You should keep on producing. Why this happens? Why Ayurvedic medicines are active? What for they are active? Today also they are active. But what about in modern medicine? Why this is happening? Because they are directly targeting the infection. So that infection means it may be a pathogen, a bacteria or a virus, and these will be very effective when it was introduced. Later, the bacteria and virus are also created by God. Human beings are also created by God. They gain resistance, armory in this war. This is a war between the humans and the bacteria or the pathogens. So they develop what is known as armories. For the armory or whatever you shoot against them, they develop resistance for that. This is what is going on. It is like a samara. Rama Ravanara samara. There Ravana died, but here the Ravana is not dying. The pathogen Ravana is not dying. He will come back again. So this is actually going on. What I suggest is, for acute infections like maybe COVID, the recent one, whatever it is, maybe the medicines, antiviral, everything may be good. But in long run, we have to see and develop our body, the human body itself, stronger to withstand the assault. See, the assault is not only from outside. So when a pathogen enters the body, in response to that, there is an antibody developed, that is antigen is developed by the pathogen. A response to that, an antibody is developed. So both have their own fight. Sometimes what happens, when they are fighting, we get fever, okay, we may get headache. If it is a small abscess, there we may get pus. And if that battlefield is very small or very soft, very spongy, like our lungs, there it cannot withstand the battlefield. That is what happening today in COVID comorbidities. The whole world has to fight for this. Corona or COVID-19 is not so dangerous without the joining comorbidities. It is just a fever. But now our question of the world itself is that how to save this 2% or 3% who get affected. That is the comorbidities, and they develop pneumonia and they become very serious and they are put into ventilators. Of that, about 70% they die. The death rate is 70%. Now this is the task for the entire world. But we can tell Ayurvedic people, particularly when it is a respiratory system, there are there are seasonal, annual evacuatory procedures like Vamana and Virechana, okay, where the particular morbidity producing, the morbid tissues, the morbid product which is there, that reaction, we can reduce the reaction by giving Vamana, that means emetics. Vamana is done in spring season and Virechana is done in rainy season. They are all highly sophisticated super speciality Ayurvedic treatments. It is not simple. Okay, it is not simple. Simple, but the patient should cooperate, they should come. So this procedure throughout the world it should catch up. If a person who has got allergens which enter into the producing pollen grains or anything which enters into the system, respiratory system, they develop allergens because there are the antibodies which come to act there, the antigen and the antibody, and worsen these two. That is, the misfortune is in the lungs, respiratory system, it cannot withstand that battle. So we are with this Vamana karma, Shodhana karma, where we eliminate these toxins periodically, the reaction to the antigen will be reduced. We can reduce the effect of battle between antigen and antibody in this soft tissue of lungs. This is needed today, everybody. And added to that, we need to have something which is being gifted to India by the ancient people, that is the Ashtanga Yoga. So it's a combination. A person should do yoga, yogasana, pranayama, okay, all the 8 he has to do, practice it. So then he will be able to, he means we will be able to conquer this COVID. Now we have to learn how to live with this COVID henceforth. It is not going to get lost. It is the beginning. Okay.
Thank you so much for sharing about Ayurveda, doctor. And talking about COVID brings me to my second question. COVID itself, it's paralyzed the whole world, and the whole world is in the shock to recover. Is there treatment from Ayurveda for all these signs and symptoms shown through COVID? Can you please talk to us about that?
Yes, Vijay. Before expressing the treatment for COVID, I want to tell you one information from Ayurveda. The diseases in Ayurveda are grouped into 4 groups. That is, one is Sukha Sadhya, easily curable. Kashta Sadhya, difficult to cure but are curable. Yapya, as long as treatment is continued, it is curable. And Asadhya, which cannot be cured. They were very precise in telling this. So in respect of this COVID, so initially it starts like any other cough and cold with fever, like a flu. The first day itself start with Ayurvedic medicines. Ayurvedic physicians will give Ayurvedic medicines. They are both antipyretics and also immune boosters, immune regulators. Okay, 2 things are there: immune boosters and immune regulators. Anything problem with the immune booster effect, where antibody becomes more powerful and the battle becomes more rigorous, there we need to have immune regulators. So like that we are going to start the medicines. First day, second day, third day, okay. In classical Ayurveda, first 3 days, until and unless the patient asks for or feels thirsty, give him hot water, very much hot or so much hot he is able to consume. We also add sugar to it and give sugar water. When in fever, it needs sugar water also. Later, if he has feels thirsty and also hunger, then we are going to give him a gruel preparation, rice preparation, wherein 1 part of rice is boiled with 8 parts of water. Once it is baked well, only the water portion is taken and administered. Okay, only water. To that you can add salt or you can add trikatu. Okay, trikatu means there are 3 drugs. It is shunti, maricha and pipali. Shunti is your ginger, everybody house you have. Maricha is pepper you have in your house. And then pipali is long pepper, you need to now keep it in your house. These are 3, shunti, maricha and pipali. A very little of this has to be added to the ganji and this has to be consumed. The first one without rice, filtered water, is peya, the next one is vilepi and the next one is manda. Okay, they are different strength. Suppose the patient is a non-vegetarian, this is for vegetarian as well as non-vegetarians. If he is non-vegetarian and he longs for mamsarasa. In Ayurveda, mamsa means meat. Just told meat means it is always goat meat only. No other meat, only goat meat. Milk means cow milk only. Okay, a very thin mutton soup, meat soup should be given if he accepts. Or if available and if the constitution permits, there is one lava bird. It is a small one. It is a small one. It is also sold. So the meat of that also can be given. That is soup of that also can be. Or chicken soup can be given. A tender chicken soup. This can be given in fever conditions. Very little. Okay. So first day start with medicines. I told you the best antipyretic, more effective than paracetamol we have. I will show you later. Along with some rasaushadis, not just kastaushadi. See here, Ayurveda we have got kastaushadi and rasaushadis. Here in such conditions we have to give rasaushadis like Sanjeevani Vati, Ananda Bhairava, Tribhuvana Kirti, etc. And also Dashamularishta, okay, Amrutarishta. Then if he has cough and cold, we have to give Vasavalehya, Sitopaladi Churna. These are the medicines we start in the beginning. Okay, it is first day, second day, third day, fourth day, fifth day. If the fever reduces, continue it for 10 days and you can stop. If this fever does not reduce, subside, added to this, if the patient develops wheezing, that means shwasa, then with these medicines One more medication, most important, sedation therapy. Sedation means giving warmth. Okay, sedation therapy should be given on the back, not on the chest. However much higher the temperature is, we can reduce it by giving Shita Jala Prakshalana, cold water. A cotton cloth dipped in cold water. You can keep on wiping the forehead, entire body you can apply. But at the same time, we have to apply over the back Vatahara Taila. Vatahara Taila. All Tailas are made out of Tila Taila only. Yellow. And smear a little of rock salt or common salt. Then keep a cloth and give very good fermentation. Very, very good fermentation. The temperature may go even 50, 55, 60 degrees. We take bath, no, the hot water like that. Very hot water, we take bath, is it not? Not like 100 degrees. It may be not even 80. It may be 60 degrees. So much hot has to be, fermentation has to be given. Svedana. Okay. That we can do it with the hot water bag also. It is clearly stressed in case of fever. If the high fever, if a person gets wheezing, so you should consider it as a severe condition, not ordinary, not just it will go away, a serious condition. So okay, even with this, after 5 days, this is only pertaining to coronavirus, COVID-19 I am telling. When we pass, even 5th day is passed, fever and wheezing is not reducing, there is involvement, pathology in the respiratory system. So in the 7th day, if or the 5th day, the patient should be hospitalized. If he is able to take orally, the same medicine can be continued in coordination with the doctors who are treating, whether it is modern medicine or whatever it is. Ayurvedic medicine, Shastriya Ayurvedic medicine can easily be mixed with allopathy medicine without any adverse drug reaction. So far, everybody speak, but you don't get even one medicine, Ayurvedic medicine, when combined with allopathy medicine, had developed adverse drug reaction, not found out in this 70 years. So modern medicine has got 70 or 100 years. Okay, it did not. There is not. It is not there. So the doctor also should agree, modern doctor. So this should be given. So here, one more thing I wanted to tell. This morbiditis involving the respiratory system, where there is allergy, allergen, antigen, antibody, from antibody to this mast cells, okay, and cytokinase, as a severity keeps on going. So when they keep on going, you understand, there it is not so easy to control. In such case, the patient has to be under ventilation, okay, under the supervision of specialists. Everything happens. Now, this morbidity, how many people in the world or in India, in our country or in our state, are having respiratory allergies? It is easy to find out. So what is the thing we have to do is, even before getting all these diseases, periodically, and whenever they get any allergy, the easily available drugs, one drug I would like to say that is plant is Vasa. It is a Adusa in Hindi, Vasa in Tamil, Telugu, everything, Vasa. Okay, this is a shrub, a small shrub, not very big shrub, a small shrub, grown very well everywhere from coastal area to maybe 4,400 and 4,500 feet above the sea level. So you can see this in Chennai, you can see this in Bangalore, you can see this in Ooty also. And usually in village side, they plant it as a boundary. Okay, that Vasa sin, it contains chemical composition, the active principles. It is easily available one. You have understood now? Very easily available one. Everybody should have such plant. Even the government missionaries, especially forest department and Ayush department, should encourage. It's not so difficult for forest department. They can grow thousands of seedlings and distribute. You should have Vasa Vana. Every house should have this Vasa. This Vasa actually works at the stage of this, I told you, no, allergen, antigen, antibody, okay, and so on and so forth. So this should be advised. It is easy available. This and the periodical Shodhana karma, that is Panchakarma. Whoever is having any allergy, such problems, they should go for Shodhana karma, as I told you. So now the important thing we have to tackle is the comorbidities. But for these, COVID-19 is a simple fever, cough, cold and cough disease. Okay, and also to avoid, one has to take, I told you, simple nourishing food every day in practice. There are some practices like if you go to a village side or to say South Canara, there they all prepare very good liquid thing like a ganji, or they call it as a tamli. Okay, so we also prepare ganji, we prepare some rasam, is it not? Maybe because of this the severity is less in India. Okay, so these things, and soups, that is vegetable soup, shaka soupa. Shaka soupa is vegetable soup. And then the green gram soup, mudga soupa. Okay, very thin soup should be consumed to nourish the body. And you can also take, non-vegetarians can take these soups, and also they can take chicken or goat meat soup, the most important thing. Along with this, they should have the practice of doing pranayama and yogasana. It is actually a gift for the mankind from our ancient India.
Thank you so much, sir, for providing such detailed information on how Ayurveda can make a difference in the current COVID era. Right? Well, talking about Ayurveda, health, fitness, in the current generation, most of us feel or prioritize looks over core strength. To give you a simple example, a person who is of teen age may feel having six packs is more powerful than core strength. That's the condition of the current world. I want to ask you today, what is the importance of core strength, and also through the practices of yoga or Ayurveda, through your experience, what are your suggestions? Can you talk to us about it?
So here, what I meant to say, you have asked core body strength. Okay. The core body strength is the strength of your vital organs. Okay. Maybe like lungs, and it may be heart, the other visceral organs. To develop the core body strength, one has to practice yogasana and pranayama. Okay. So yogasana is I don't say it is an exercise, but attaining the postures. That man was created on this earth by God with 4 legs. Okay. The front extremities, legs and hands, they are both. And this 4-legged man somehow stood up. And maybe because of erect posture, we might have lost some of our important strength. Okay. For this, the first person to compile Yogasana and Ashtanga Yoga, the Patanjali, Patanjali. So he has created some postures. All these postures are named after designated animals, like Bhujangasana, the serpent posture, Hanumanasana, and Gomukasana, Kukutasana, Mayurasana, Shalabhasana, Makarasana. Makara means it is crocodile. Okay. So all you name any asana, it is after. Even Shvanasana, dog asana also. Shvanasana. Cat asana. Okay, like cat. Why they have made this is that let your entire body also become strong, like the physique and strength proportionate to their body weight. For example, you know what's the capacity of a cat? How much it can jump, how much it can climb. A monkey, a dog, if you have a pet dog, okay, a Labrador, any dog, how much strength it has got. Okay. So like that, you want to gain strength, you do yogasana. You want to give strength for your vital organs, you do pranayama. Start practicing pranayama. Okay. It gives vital capacity of lungs so much that it can enlarge. You can hold after practicing pranayama, and okay, you can hold your breath for more than a minute. Some even hold for 5 minutes. Okay. Some sadhus who are well versed in this pranayama, they can hold breath for a longer time. In capacity, the inhaled air, the oxygen in the inhaled air is much absorbed into the system. That's why we can hold for one minute. Okay. So this is the most important thing. All these are, if you think they are exercise only. Pranayama, take it as an exercise, it is exercise only. Pranayama, see, when you lie down or you sleep or observe or a person who is sleeping, only their abdomen keeps moving. Okay. Pranayama is the same. You only train your muscle, the rectus muscle, the abdomen muscle. Next I will tell, when I tell the answer the other question also. So it is an exercise from inside. It is prana, vayu is taken inside. okay, and the entire abdominal viscera get trained, and you are able to eliminate so many ailments with this. The most powerful core exercise is pranayama. Next comes this asanas, and in Ayurveda there are Trayopastambha, on which Trayopastambha means tripod stand, on which the health of a person stands. They are Ahara, Nidra and Vyayama. Vyayama, you can take it as Brahmacharya or Abrahmacharya for married person, but Vyayama is compulsory. Okay, here in Vyayama, Ayurveda does not say about Pranayama or Asana, because there are two different entities. Only a yogi should speak about yoga, and an Ayurvedic person should speak about Ayurveda. See how much they have kept the sanctity for their systems. So like that. So yoga is for yogi. Okay. So now nobody in this world, or the majority, they don't want to become yogi. Yogi means you are going to renounce from everything. You leave your family, you leave your wife, you leave your child, you leave everything. Okay, in charity you give everything to others and go away. Even you do not know what food is served for you, how you are going to take bhikshu. Understand? So he does for renunciation, he does. I think that is not advocated today. Nobody will accept. If you tell you leave everything and go away, then his wife will beat him. Okay. So we have to take certain things from Ashtanga Yoga. All the 8, there are 8. From all the 8, we have to take the essence of it, and we have to make an integration with the Vyayama described in Ayurveda. So what is Vyayama? Vyayama is the one which you are going to do for better action of your body and muscle. You want to do something. You want to plow your land, you have to do it. You are going to cycle, so you have to do some required exercise, Vyayama. Okay. You are going to be an adhva, a postman carrying post from one city to another village to another village. Then he has to improve his Vyayama. Okay. And accordingly he has to take good food also. Okay, this is the one. So Vyayama, your exercise, is only for your better physical action. The same thing we see in military training and police training. Always remember, it is simple. Military and police, they do, see, they are not see, for their weight they are very strong. For their weight they are very strong. Okay. So this is about the core body strength and the other body strength. And now in the modern days, some younger people have the fashion, this is fashion, for developing muscles. So they go for this gym, okay, which I have never gone. Okay. For gym they go, and what exercise they do with weights, lifting. Before that, I want to tell you one thing. Our body constitution is made out of 7 dhatus: rasa, rakta, mamsa, meda, asti, majja and shukra. Okay. Rasa is the digested food which is absorbed into the system, into the blood system, that is circulatory system. Next one is rakta, is blood. Third one, mamsa, is muscle. Fourth one is meda, is fat. Fifth one is asti, bone. Sixth one is majja, that is the inside the bone, the greasy material or red bone marrow inside the bone. Okay, the last one is shukra, that is anta shukra, and another one is bahya shukra, is semen. Okay. they are like 7 paddy fields, square paddy fields. When we water first one, it keeps on going to the last one also. Okay, it goes. So that is our system. So whatever you eat, it enters your rasa dhatu, then rakta dhatu, mamsa dhatu, lastly it goes to shukra dhatu in proportion to the their proportional constituents in the body. Okay. Now I want to develop my body. I want to lift weight. I want to become a weightlifter. I want to put on muscles. Okay, everything I want to do it. Only he always sees biceps. I want to see biceps. Everything he wants to do. Okay. Then what happens? The flow is chucked at mamsa dhatu. The flow is chucked at mamsa dhatu. The subsequent dhatus will reduce. Okay. And finally, there will be even reduction of shukra also. Okay, because he has put on so much weight. His right from the pituitary gland, okay, all the secretions which are there for the production of androgens, function of androgens may also reduce. But it is not the case with wrestlers. You understand? So wrestlers, their body is different. Sportsmen, their body is different. Okay. So this one should think. They should understand. I am developing only muscle. What about the next dhatus? Okay, the youngsters should understand. With this, the best, even better thing is swimming is a good exercise as well as pranayama. There, a swimmer does pranayama also. His trunk, everything, his capacity increases. Swimming is a very good exercise where both are there. So this is regarding the exercise. A person wants to look like a horse or a buffalo, a he buffalo, Kona. And a he buffalo, how does it will be? Or a bull. So choice is yours. You want to be like a horse or you want to be like a buffalo. Okay. But in their lifestyle, they are good. They have developed, but we don't want to become like that. Okay. Ati vyayama, over exercise also may lead to different diseases, catabolic diseases. Okay.
Thank you so much, Doctor. The importance of core strength has been explained the right way through all your knowledge and practice, which is very much needed for the current generation. Physeek as a brand itself was built on the foundation of helping people. We are here to help people, be it through fitness, health, and various forms. If we were to approach you to seek your guidance or your suggestions to help someone, do you have somebody in mind?
Yeah, definitely I have one person. She's a lady. She must be now 30 years old. She is crippled with polio attack. And her father divorced her mother. Mother is doing some small work, earning from 15 to around 15,000 rupees. And she is in distress, girl. The girl may live long, but mother is getting aged. What happens to her in future? So I just always think, and I also help them with some their needs and financial assistance also. Yeah, this is what I wanted to definitely.
So we thank you so much, Doctor, for sharing your knowledge with the viewers of Physeek, in fact, which is very, very crucial and helpful. And we will come back to you for different topics, and you can definitely share your experience on the same. And we thank you and we wish you all the best in the current service which you're doing, and we're looking forward to get partnered with you. Thank you, sir.
I thank Physeek for this opportunity. Thank you very much.